Okay, so hi, my name's Joshua Brown, N88298553, and this is my second reflection for paramedic practice 2. So reporting and responding, for this reflection, I've chosen to actually reflect on two cases. So both of them were STEMIs, and I got them about within 2 days of each other. The first case was just classic. It was like diaphoretic, massive chest pain. It was just so blatantly obvious that he was having an MI, and that was confirmed by the ECG. The second case was actually a lung cancer patient, and I kind of pigeonholed this one as pleuritic chest pain, just by the presentation, the pain assessment, and the history. The reason this is relevant is because often we can get tunnel visioned on some cases, and I wish to reflect in order to help myself see the bigger picture and to make sure I use all my tools to make sure I don't miss anything. So I'm going into my 4th year of study now. This is my second prac, and I've become much more comfortable with treating patients and trusting my decisions, I guess, and relying on my tools. So in particular, this one, the 12-lead ECG, so it doesn't take much time, it's very cheap, and it would have just really helped me in the second case to just give me undisputed evidence as to what I was actually dealing with. It's really opened my eyes that despite experience, it's imperative to maintain a systematic approach in which you use all the tools that you have available to you. On this case, I did use many tools. I used my pain assessment. I did a very thorough history. I used pain management and many of these other tools. But unfortunately, I missed. I did a 4-lead, and there was no changes on that. But I missed the 12-lead, which I definitely should have done much earlier. It took me about 30 minutes before I did that, and then we realised that yes, it was in fact a STEMI, which was not very good. So if I had used all my my tools, it would have shown. I would have had clear evidence that it was in fact cardiac in nature, and that my care obviously needed to change. And just what really opened my eyes was just how amazingly different the two presentations were. Obviously, into reasoning now. Sorry, obviously STEMIs cases are extremely important. They require very quick diagnosis and appropriate care. And once again, it was this 12-lead ECG was nowhere near quick enough. Reading some textbooks, emergency trauma and care, for example, they put ECG in the vital sign survey, and that's so that you can find and diagnose issues very quickly, and you can adopt, appropriate care to do this. And this is particularly important with chest pain. Despite how it presents, it's really important. Any chest pains, I really did pigeonhole this one and got tunnel phobia. Me and my mentor. So it wasn't just me. It really showed me that despite your experience, you really do have to maintain this systematic approach for even the 1% of people that could. They're very, very small chance of having an infarct. As I was saying, so our pain assessment was sharp, came in waves, worse on palpation, inspiration. It didn't radiate from the center. It just really did fit pleuritic chest pain with the history of lung cancer and the frequent coughs and all of this information. So I delayed my ECG by 30 minutes, and that was very, very, very poor. And I was beating myself up for a while, but I think reflecting on this now, it's really helped me to make sure I basically reconstructing the information I've got from this. So cases present in a variety of ways. Some of them, like the first one, it was just so obvious that he was having a STEMI, or well, not a STEMI, but an infarct of some sort. And then, you have to really be careful of these other ones that, they present a bit atypically. No diaphoresis, she just really looked quite well, despite the fact that she was obviously a cancer patient. But, from the literature, CPM and some other textbooks that I've got here, it's so important to adopt this systematic approach. It's that way, there's no way you can miss anything. If I do that, I think I'll ensure that I maintain safe and effective practice, and I won't get tunnel visioned on any more cases, and I'll be able to make informed and rational decisions. So, thank you.